Welcome back to Short Burst. Today in this video we are going to discuss about the routine semen analysis done in a lab. So if you're an androtech or starting a career in andrology, the first thing you need to start is your semen analysis. So before starting this analysis, there are certain things that we need to take care of. Starting with the first is your abstinence days. When did the patient had their last intimate genital contact with the partner, which it must be 3 to 5 days. Abstinence is mentioned here because something lower than this or more the days, it may hamper the volume, the semen volume, or the sperm parameters when you're going to count. So abstinence is very important, needed to be considered and taken care of while you are proceeding with your analysis. Next, we are going to check its liquefaction time. Yes, we take the semen sample and keep it in room temperature for 15 to 20 minutes at room temperature to liquefy it. We also can use transfer pipettes, like different lab have their different protocols to liquefy the semen. But before starting your semen analysis, you need to keep it for 15 to 20 minutes. Next comes the volume. The volume must be 1.5 ml because if below 1.5, it might be considered as abnormal. Then comes your color and pH. So your color, well, while you are checking it with your eye, it will be very visible and evident, the color. It must be whitish gray in color. Okay, anything rather than that must be mentioned in like whatever sheet you are having, the diagnosis, it will be included in it. The pH must range between 7.2 to 8 because pH required for healthy semen is the range according to World Health Organization. Between 7.2 to 8. Anything less more than 8 must be again noted. So after completing all this, we'll move to microscopic examination. Here we count the total concentration, which according to WHO must be 15 million per ml, the range of total concentration. Now how are you going to count this concentration? So there is this macular chamber in which we are going to count, and you have to count at least 10 of the fields in the macular, and then you are going to calculate an average of it. After counting 10 fields, we take an average. Okay, so I'll show it in later part. Next, you check out the sperm count. So the sperm count parameters must be 39 million per ml. So different patients can have different sperm count. Some may have 5 million, some may have 10 million, some may have 100 million. So there is an average range given by World Health Organization, and that is 39 million per ml. Anything less than that may be considered in the category of like low count or infertility. So next comes the sperm progressive motility. Progressive means how fast the sperm moves. So there are certain criteria we count the sperm motility. So the fast moving in a straight direction is known as rapid sperms. Those are rapid sperms, and you put it in category A. The slow one is which is moving but not that fast and in a straight motion, that is slow, and we put it in B category. The next is non-progressive, which means twitching motile. That means it is a motile sperm but it cannot move, is known as non-progressive. And the last one, which is not moving, not showing any kind of motility, it is known as immotile sperm. So when you count your rapid sperms and slow sperms, the reference must be 32%. That is the reference given in WHO. The last we count is the morphology of the sperm, that how does a proper sperm looks. Now look, there may be some defects that that is very necessary to check that whether the sperm is having any kind of head defects or mid-piece defect or the tail defect. This is very important to count. So if we get at least 4 normal sperms, then it is considered as normal sperm morphology. But if we are not getting any normal sperms in that particular semen sample, then it may fall into diagnosis, which may be considered as teratozoospermia. When the sperm morphology is not good, we considered it as terato. we check the morphology because the patient may have certain kind of addiction like smoking or drinking, which may hamper the sperm morphology. So it is important, and that's all about the today's semen analysis video. Thanks for watching. I hope this video helps. Do share, subscribe. Thanks for watching. Bye bye.